What does it mean to unconditionally serve your community? At ICHS, to serve is to provide health care for all people who face barriers in life. Since 1973, the International Community Health Services staff has worked to remove and overcome barriers so people can live healthy and meaningful lives, and to provide a level of care every person needs and deserves. The reasons people work at ICHS are varied, but they all have one thing in common. They're there because of you.
My name is Janny Sun. I'm the School Services Administrator for the Community Health Services Department. Soy Jenny de la Clínica de la Escuela. What I enjoy about my job is that it's different every day. It can be kind of tricky and certainly a little bit difficult to navigate, but there's always a new challenge to problem solve. There's always the opportunity to do what's right. Okay, so we're gonna schedule your next appointment with the nurse in 2 weeks. You hear a lot of sob stories about the immigrant experience. You hear a lot about how people overcame a lot of tribulation and difficulty just to get here to the United States. But you don't hear very much about how then they build a life for themselves here, despite a lot of systemic things going against them, frankly. But it happens every day. That's the immigrant story, is that people come here with next to nothing and make something beautiful out of it. And I think it was just really nice to be there to see that happen and to be reminded that the communities that we serve are extremely resilient. They've got a lot of protective factors. They're really strong individuals, and sometimes you just need to be there to give them the support that they need and deserve.
The path to serve one's community is different for every person. Sometimes your life's work is a reflection of your own story and how you honor the values of your family.
My name is Solomuna Haptu, and I am serving as the Assistant Dental Director at Shoreline.
So we have a couple of fills that we got on the lower right.
My parents were both born in Eritrea, and so they came as refugees. My parents both worked very hard to get educated coming to this country. My mom's a social worker, and that has really been an eye-opener to me and my siblings for service to others. I always knew I wanted to work in community or public health. I just love being an avenue to access, and that's what all of us as providers are here. Just our presence, simply just being here, allows patients to have an ally that cares about their health, specifically their dental health, and their overall well-being.
I'm Dr. Selena Makadangdang Hayashi, and I'm a second-year resident physician, and I'm just finishing my resident training here at the ICHS International District Clinic. What brings you into the clinic?
Well, I'm not feeling like 100% of myself. I just want to find out what it is.
I have a special soft spot in my heart caring for our Asian elders. I was raised by my grandparents, and really because of that, I see my grandparents and a lot of the patients here. When they would go to the doctor, they didn't always have an interpreter. They were immigrants from the Philippines and field laborers in Hawaii. And I saw them really struggle. They wanted to please their doctors. They, of course, wanted to be healthy, but also didn't have people advocating for them. They didn't have doctors that necessarily spoke their language or took the time to really explain what was going on. Learning about the work here at ICHS and how there's all of these resources for patients, from language interpreters in person to community liaisons and all these supports and behavioral health and acupuncture. It really just sounded like such an incredible resource for patients. And after experiencing even just a few minutes touring this clinic, I thought to myself, this is where I want to work.
Dr. Alan Chun. I'm one of the PACE providers here, one of our newer programs for ICHS. And I've been with ICHS for 25 years or 26 years in different positions.
So is your problem breathing, is it worse at night or does it matter?
I recognize that people can make more money elsewhere. The reason that people choose to work here or choose to stay here, I think people choose to stay here because it's part of their community. You become part of that community. Working here makes you feel like you are making a difference. The reason I've stuck with ICHS for so long is that it's serving a community that's part of my heritage.
Sometimes, in the right place, building a life and service to your community can be inseparable.
I am Ms. Saao, medical assistant. I've been working with ICHS for 20 years, and I love my job because ICHS provided me the opportunity to make a difference to the lives of our patients. This is my first job I have since I came to United States. They offer me the scholarship while I'm working to be a medical assistant. The work that I do can improve and save patients' lives.
Each and every day, International Community Health Services shows the world what it means to serve your community, to provide care and comfort for those in need. We all can honor this work by providing support in whatever way we can and say, we appreciate you, ICHS.